Thank you so much, Archbishop Boris. I don't speak one word of Ukrainian, sadly, and I'm very sorry I don't speak Ukrainian. But I think we speak the language of the heart. And hopefully my inability to speak your language, you'll get a sense that I'm with you in my heart. So I just am so happy that I could spend some time with you. And especially during this time, I was saying that a year and a half ago, I never would have dreamt that I would be here now, seeing the situation continuing here, the war continuing, and the situation even more dire than it was a year and a half ago. So the slides hopefully will give you an idea of what I'm going to be talking about, but I'm not going to have a text for all of this, okay? This area of trauma, grief, and suffering during a time of serious national crisis has been one that I've been involved in for quite some time, beginning with my time in Canada. As I started to think about today, I was recalling how important it is for us as human beings to be able to stand with each other in a time of crisis, and especially in a time of war. Most recently, I've been involved in working with Christians in Iraq, specifically with the Christian community that is suffering persecution in Iraq. So during that time in Iraq, you know that the Iraqi people suffered a lot of murder, torture under ISIS, Daesh, in Iraq. The Christian community was shattered, broken. People felt that they had no life ahead of them and needed the rest of the world to step in to support them so that they could claim life in the middle of such tragedy. In a similar way, now in Ukraine, you have resources, lots of resources, but you're in a time when it's a serious, serious blow to the future of the country and the future of the hearts and the souls of the Ukrainian people. So it takes friends to come and spend a little time so that you know that the rest of the world has not forgotten about you. I would like to know how many of you are mental health practitioners? Raise your hand if you're mental health. No, counselor, social worker, okay. And how many of you are church professionals? Priests, pastoral workers? Okay. Okay, I just wanted to get a sense of who's in the room. I think in this time, key to the recovery of a country is going to be the very close relationship between the community of faith leaders and the mental health professional community. Together, these two groups will help to bring about healing in our countries. Okay, so most of you know that when people are in trouble, oftentimes the first person that they go to is the parish priest. So I see the clergy and the pastoral people as being the first responders to people in crisis. Then that's followed by the mental health practitioners, who oftentimes then are called in to assist. So I think it's together that we really make the impact, and that's why a meeting like this is so important, so that we can speak together. Today I'd like to take one aspect of this crisis time and focus on it, because it's a normal part of the experience of every single human being, and that's the experience of grief. So when we talk about grief, we know that grief is something that we experience because of a terrible blow, spiritually, emotionally, and physically, in the face of loss. And here in Ukraine, it's the whole country that is experiencing this, because you've lost friends, you've lost spouses, you've lost relatives, you've had, some cases, had to lose homes, people have had to leave their villages, people have lost so many things. I want to talk specifically about this issue of grief, and grief is something that is normal. Grieving is a normal human response. It's not pathological. It doesn't mean people are sick. Grieving is part of our being a human being. And so one of the issues that I see across the world, and it's not just Ukraine, and it's across the entire world. It's across the United States, as we deal with active shooters killing our children in Uvalde, Texas, massacring a grade school population of third grade children. It's happening in Iraq. It's happening across our cultures, and people are suffering who do not know how to handle grief. That grief can eat us up and prevent us from moving on with a successful life. And this is where I think pastoral people and mental health professionals can collaborate to try to help our communities manage severe grieving and do a better job. Part of what's happening today is, I've noticed, that we tend as human beings not to be able to talk about in depth about what's happening with us when we've lost someone. We say, oh, I lost my brother. My brother was killed in the war. My child was shot in Detroit. End of story. There's much more that's happened in that human being than that event. There's a whole story behind that. What happened? What did I see? What did I imagine? What really happened? I can't talk about it because I'm afraid that it will add to somebody else's grief. So my purpose today is to take a look at that kind of deep, deep loss, the deep loss that affects us and pervades our lives when we go through an experience of absolutely unimaginable loss of a human being that we love and care for. What happens to us? And how do we, as helping professionals, walk through that situation with an individual or a community? How do we help them walk through that situation and come out so that they are not spending the rest of their lives traumatized by unresolved, complicated grief? First of all, grief is normal, okay? It's not pathological. And ultimately, you and I are all on a path of letting go, gradually letting go of many, many things until the final letting go of our lives into God. So we're all on that same path. So it's so important for us to be able to work through that grief, and this is all on the slide, so it's okay, to work through that grief so that it doesn't become locked in our psyche and make us ineffective in living our lives, both as believers and as citizens for the common good of our countries. So, that being said, I'll talk about, first of all, some of the issues around where we can get stuck in working with grief, and then take a look at two models of working through grief in our parishes, in our communities, in healthcare and in pastoral settings. So I've come to realize that the power of healing is often released far more powerfully when we're in a group setting where 2 or more people come together to talk about their grief, to share their anguish, to share their pain and their sorrow. Let me give you an example from my experience in the inner city of Detroit, Michigan. I was working in a large teaching hospital, a Jewish teaching hospital in Detroit. And we had an ongoing sessions dealing with grieving. And one day, in my group, I had in the group a man who was a survivor of the Holocaust in World War II. The other person in the group that was powerfully impactful to me was an African-American woman who was living in the inner city, very poor, living a very rough life. The Holocaust survivor, he had escaped from a ditch where he and his family were forced by the Nazis to stand in the ditch and wait to be shot. He crawled out of the ditch on his stomach and he sneaked away while he watched his family be buried alive. He was an 80-year-old man who had never talked about this situation ever in his life. 80 years old. He lived his life in silence and isolation. He refused to tell anybody about what he experienced during the Second World War. His rabbi was the one who noticed that this man was very, very sad and could not speak to anyone. And the rabbi invited him to go to the Jewish hospital to see if perhaps someone there could help him through this program on grieving. He trusted his rabbi, and the rabbi knew that he would trust going to a Jewish hospital. The rabbi accompanied him to the grief group. That's very important, because the church professional is accompanying the very damaged man, accompanying him, walking with him, supporting him as he approached the very, very tender task of, for the first time, telling his story. So keep that in your mind. Okay. In the group, there was a young African-American woman, a mother of 2 teenage boys. That mother saw her 2 teenagers executed in the streets of Detroit in front of her. These 2 human beings, very different backgrounds, different ages, different nationalities, very different experiences, came together in a group setting and very gently began to tell their story. The woman got to the grief group because her Baptist pastor encouraged her to get some help, because all she did all day long, and all night long was cry. So in both of these situations, it was the church professional who helped the very, very hurting human being take the step to get some help to begin to work through their grief. Very important that it was the church person who helped them and accompanied them. Without the church professional, neither of these people would ever have sought help. Now, what happened to both of these people was that they had slipped into something that we call complicated grief. Okay? They had been holding it in so long and never talking about it that they now had incorporated grief as a part of their identity. So in these cases, their whole lives had been absolutely consumed by grief, and they could not function. They were alive, but they could not thrive. So what I want to do is to help us learn how to intervene before that happens to someone. What can happen to us when we're working with grief is we can get stuck. People can get stuck along the way of trying to get through a very traumatic, difficult situation. So I'm going to talk about where people can get stuck or get to come to an impasse, and then how we can help them work through that as pastoral people and as mental health professionals, okay? So what is complicated grief? What is complicated grief? Complicated grief really is when, as I said, that all those feelings stay internalized and become part of the identity of the person. So they're consumed by sadness, fear, anxiety, feelings of guilt that they should have done better. The Jewish man, the Holocaust survivor, that he didn't save his family. The mom who watched her children get executed because of gang violence. She felt she was not a good mother, that she should have protected her children. She should have done a better job. It's important to realize that there's a difference between grief and depression. And sometimes mental health people make a mistake of thinking they start to treat the person with depression instead of realizing that they're dealing with a very human situation of grief. So we don't want to make a mistake of diagnosing someone as ill when they're dealing with a human response to a terrible situation. So just simply, depression is a preoccupation with the self and the person feeling self-critical, having a lot of pessimistic thoughts about themselves, ruminating, feeling worthless. Okay, that depression is serious illness that needs mental health treatment. Grief, on the other hand, is really a situation that's a person's normal preoccupation with thoughts and images and memories of the deceased and the events surrounding what happened at the time of death. That's very different. So grieving is thinking about the person you lost. Depression is focused inward on the self and preoccupation with the self. I'm simplifying a lot, but just trying to make the distinction so that you see that grief is not a pathological condition, but it's a response to a loss. Okay, so I want to stop there and just make sure to see if there's any question about anybody have any questions or observations that you would like to share.
How often is this mix of, between grief and depression made, and can you say more why that distinction is important?
I would also ask the mental health folks in the group to respond to this as well, but I think the mistake is made quite often, where it seems like a person is dealing with grief. They go to a mental health practitioner who's not particularly tuned in, and the mental health professional prescribes an antidepressant medication, which may be appropriate, but is not the answer.
Я можу теж додати, що це потребує дуже різної допомоги, що коли людина переживає втрату, вона потребує доброї підтримки у пережитті втраті, у пам'яті, у висловленні почуттів. Депресія потребує дуже іншого лікування.
Питання на рахунок, бо ми працюємо з групами, і ті групи бо є втрата або загинув, а є безвісті зниклий. Чи їх об'єднувати можна, чи ліпше розділяти ці групи?
Oh, two different groups of people where you don't know whether the person is living or not. Yeah. So the loss to the loved one is living in that ambiguity. And I don't see a necessary problem with having them together because you don't know. They understand that human experience, lost because of I don't know, and lost because I do know, and the person is deceased. So I don't see a problem in having them in a group conversation together. I've had people with different kinds of grieving in the same kind of group because the human emotion is the same.
Ще одне в мене питання тоді, як би для тих груп робити програму, бо в нас був досвід, ми запрошували на 2 дня і трохи їм було заважко. І зараз робимо, що вони приїжджають на день, з 10 ранку до 6 вечора.
I'll get to that in a minute. You read my mind. What I want to do is talk about the three movements in working with grief. A person grieving, or even in a group of people who are dealing with grief, okay? Three different things to think about. This is based on some of the work that's done by a colleague of mine, Dr. Bob Niemeyer, who's a grief specialist. He helps us to remember as helpers what we need to focus on in a very simple way. So the first thing to focus on is the event story. What happened? The event story. What happened to the person? Or what do you think happened to the person? Or what did you see happen to the person? And what was happening inside of you? All right, so that's the event story, the event of the death. So the event story is the first place where people can come to an impasse. The second area where a person can come to an impasse is the back story. So the event story and then the back story. The back story refers to the relationship, my relationship with the person who I lost. What was my relationship like with my spouse? Was it a good relationship? How did I feel about our relationship? What kinds of stories do I have about the backstory of our relationship? Can I talk to people about that backstory? Can I share with people some of the highlights and the good times of my relationship and what's happened since the loss? So that's the backstory. So what happened and then what led up to it and how did I feel in the relationship? Again, many people never have the freedom to talk about the backstory, about the relationship. My husband and I had a wonderful first 3 years of marriage, and then we had a fight, and he went off to the war, and I never saw him again, for example. As a helping professional, I might ask the person, can you share with me what was some of the wonderful things about your relationship with your husband in your first 3 years together? In other words, to invite the person to talk more about their loved one. It's an invitation. It's listening to the story. So that you're there to hear the story. You're there to listen to the story as a priest, as a mental health professional, as a friend, but you're inviting the person to talk about that relationship, which we would call the backstory before the loss. So the event story, the backstory, and then the third part where a person can get stuck, come to an impasse, is the personal story. All right? The personal story The personal story is not what happened in the past, not what happened in the event of it, but where am I now? And where does my life go after this horrible experience? And it's the invitation to begin the very, very slow and gentle process of talking about what happens next in my life. And to do that with someone that's caring, that's able to listen, who can trust. We, as a helping professional, we don't have to be answer givers. There is no answer to give. There's no solution. Our presence is one of listening, receiving, inviting. It's not about questioning, probing, directing. No. I want just to say that those are the three elements that you want to focus on when you're inviting, or you're saying that you're going to accompany a person in this grief process to prevent them from getting stuck. Okay, those three, easy to remember. A mistake that is often made, especially I think in a pastoral setting, can be that the church professional says to the person, well, you went through that. You might as well get on with your life. Now, come on, how are we going to help you get involved in doing this and this and this in the parish? How can we, try to solve the problem? Another mistake would be to simply say, well, just pray about it and you'll be all right. Praying about it is really important, but that's not all there can be. Nor can problem solving be the answer. So the process of working through grief is slow. We are taking the situation seriously. We're listening intently. It's not a quick fix. It's very important to remember there are three parts to this, not just one. It's not enough just to tell the story. It's not enough simply to talk about the loved one in past tense. And it's not enough to just say, I'm going to just get on with my life now. We have to be very patient. We can't rush the process. That's why the more people we can educate about listening to the stories in their entirety, the better off we'll be, because it will happen in not only one setting. It took the African American mother, it took her probably 3 hours, 1 hour, to tell the whole story of what happened, just the first part, what happened to her children. This slide shows the attitude of the helping professional. Three important things that a helping professional must do in the process of accompanying somebody dealing with grief. And again, it's easy to remember in English. I don't know that it rhymes in Ukrainian. So we talk in English about bracing, pacing, and facing. Easy in English, but somebody has to think of it in Ukrainian to rhyme. It's exactly what the word says, that you brace, you support the person in the working through of the grief story. You support them by your attentive listening, by providing a safe environment, providing time, and allowing them to feel secure as they begin to tell what happened. Pacing, taking your time, again, slowly, not rushing a process. And facing, helping them in that process of telling the story and talking about the relationship, of beginning to face how they're going to move forward in life. So simple, three attitudes that we bring as professionals to deal with somebody who's working through grief. I want to give you another example, and this is looking at a whole community that is dealing with grief. About almost 2 years ago, there was an active shooter in Uvalde, Texas. where over 30 grade 3 children were killed. The entire village was in mourning. A group of us went down to Uvalde, to the village, to be present as resources to the community. And when I came to the village, I noticed right away that the entire village was empty. There was nobody to be seen. No one was on the street. There were no cars out. Nobody was walking outside. Everybody was invisible. And when we came into the village, all we saw were flowers all over the schoolyard. It was like the entire town was encased in grief. So the clinicians, the mental health professionals, partnered with the priests, the sisters, and the pastoral workers. And we went together in small groups, one or two of us together, 2 or 3, would go to each house together. The priest, the pastoral worker, and the mental health professional. Again, the importance of the collaboration. The people were frozen. They were paralyzed. We had to go out to them, knock on the door, ask if we could come in, and if we could sit down and have a coffee. That was the most important thing we could do, was to visit the home together. So this was the group that bridged the gap between isolation, total isolation, and finally venturing into communication with somebody else to talk about what happened to their child. So if you think about the situation in Ukraine, you are like that Texas village where the entire country is dealing with this terrible loss of life. The entire country, not just a village, but an entire country. And I just want to underline the importance of the outreach, pastoral outreach and professional outreach to people who are suffering. So the first thing that the teams did, which you can do here in your own country, is when we went to reach out, we began the process by inviting people to talk about what happened to your loved one, and to have a conversation, in this case, in the security of their own home, because that was the safest place to talk about it. So we can't expect necessarily people will come out. Sometimes we have to go there. And I would encourage you to think about that, how you visit a friend, how you reach out in your parish, how you visit your neighbor. And can you reach out? That's the way we strengthen our communities, is in that outreach. That's a first step. Now, I want to spend some time talking to you about other practical ways that you can intervene as a team, as a community of professionals who are there to help. And I want to spend some time talking specifically about a group approach that you might find helpful.
В мене таке питання, коли ви ходили додому, і якщо були відмови, то що ви робили далі? Яка була ситуація?
That was fine. We did not push it. We said, we'll come back another time when you might feel more like talking. That's an important question that you're asking, because you would never push into a situation. Okay, so we've talked about the steps to think about in attending to the grieving individual person. We've talked about the style of your intervention. So now what I'd like to do is to talk about an example of something you might be able to make use of in your own communities using a group process. And again, this is just by way of example. We have found that working with people in groups is often more effective at healing a national or global trauma than it is just one-to-one. We found the group more effective. Because in the group process, we're also beginning to strengthen the bonds of community. Now, not just one person knows my story, but maybe 5 or 6 or 7 people know my story. And you know their story. And together, we can support each other. So that kind of network begins to build in a community. Let's say you decide you're going to start a small group in your parish. And I would suggest that you keep the group, not the maximum number of people would be 8. Smaller is fine. And this model is really a development. I was talking to some of you. This is a development of a model of group intervention started by Dr. Irving Yalom and Dr. Molin Lesh in their work in group psychotherapy, and they developed a process called the agenda group, and that's what I want to talk about with you. I think it works. I know it works. I know it works. So I'm going to just talk briefly about what that looks like and how it could be applied to this situation in a parish setting of any sort. Or even it can be used in a mental health setting if you're running grief groups in your practice. Somewhere between 5 and 8 people who are dealing with grief. You set a time. Again, I would not have a time, and this is developed as a 6-session, 6 1-hour and 15-minute sessions, which could be over 6 weeks, once a week, could be over 6 days. It's not all going to be in one day. This is a highly structured process. That's very important. It's very structured. The reason for the structure is that it ensures that everyone in the group has an opportunity to speak, confidentiality is ensured, and that no one is re-traumatized in talking about their loss. So following the structure is essential. If we had a day together, we would have a demonstration group, but let me just try and explain it. The first thing, 5 minutes. You welcome everyone to the group. Ask everyone to introduce themselves by their first name. Talk to the group about the group rules. Everything we say here stays here in the room. Getting the agreement of the group. Everybody agree to confidentiality? Yes, 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 yes. We're going to start our group at 3 o'clock and we will end our group at 4:15. Does everybody understand that, for example? Set time. Not 2 hours, 3 hours. No, this is the frame. When people speak, you speak about your own experience, nobody else's, your experience. That's about 5 minutes. The next 5 minutes, the person who's the facilitator sets the agenda for the meeting. Today, this first day, we're going to talk about what happened when you learned about the death of your relative. And we're going to, each week for the next 5 weeks, we will talk about a different part of the experience of your loss. So today we'll talk about what was your experience, what happened at the time of the death that you know about, okay. The event story. You invite each person to speak for no more than 3 to 5 minutes about the event story of the loss of their loved one. I usually say, who would like to start? I don't go, you start, you go next, you go next. No. Again, an invitation. So each person speaks at the end. Has everybody had a chance to speak? This takes up the majority of the session. 6 people, 5 minutes. That's a good 30 minutes right there, which may be a little bit longer, but about. Okay, after everyone has spoken, I ask, what did you hear in common from the stories that we just shared. The importance of asking about what you heard in common is very important, because when you ask, what did you hear in common, suddenly people are no longer alone. It also ensures participants that other people are listening to them. In the process of asking about the commonalities, you're beginning to build the bonds of community. That can take maybe 15 minutes as the group begins to talk about what they heard together. Then the facilitator thanks everybody for what they've shared today and summarizes briefly what the group has done. Today we've talked about the experiences that each of us has gone through in losing a loved one. And we've also been able to talk about what experiences we hold in common as we've dealt with such loss. Next week, now you introduce the topic for the next session. In the next session, I'm going to ask you to introduce your loved one to the group. Tell us about the person. And then that's going to be what we're going to talk about in the next session. So in preparation for our next time together, you might want to think about what's important to say about your loved one to the group. What would you like to share? So that's their homework. That might take 5 minutes if there are any questions about it. And that's the end of that session. Okay? So what you see what we're doing, it's very highly structured. And that is a safeguard to the group. If you look at this following that format, the same format for the other sessions, if you did 6 sessions, you have the introduction of the loved one to the group in that session. The next session might be on the relationship you had. Again, these are very, they're like introductory, but the relationship, the backstory. So the event story, the introduction, the backstory. And then the next session might be on what you want to say to your loved one that you didn't get a chance to say. You might ask the group to write a letter to each person to write a letter to your loved one with all the things you'd love to have said to them. So that might be the homework, is to write the letter. Then the next time they come, they share the letter. They talk about it. They read it out loud. Then you ask the question, what did you hear in common from all the letters that folks shared? Again, you're building the community. You're building trust. You see, you set the frame for every single session, covering the event story, the backstory, the relationship. The relationship part may take 2 sessions or possibly 3. And then it just depends on the way the group goes. Every group is different. And then the fifth session can be the personal story. You begin to start talking, inviting them. Where would you like to go into the next step of your life? You begin to gently open up, again, slowly open up that possibility. Now, what you're hoping for is that in between, people talk to each other more. They're not all dependent on coming together, but those individuals in that group may talk with one another more frequently and begin to work through their grieving with the community. In the last session, usually I like to have some kind of a ritualization together. So you might do for the homework, think about some symbol that is very important to you about your loved one. It might be, they might bring a ring, they might bring a flower, they might bring a scarf, but bring that to the group and ritualize the time that you've shared together as a group in talking about the deceased persons. If this is in a pastoral setting, one thing that you could certainly do is to have a very simple prayer service. What I'm talking about is being able to end the group well. It depends on the setting how you would do that, so you have to be a bit creative. Okay, so that's the general framework of the structure, and it works, and it's something that can be modified to meet the needs in the setting, depending on the setting. Mental health setting will be different from a pastoral setting. But your hopes are the same, that people are able to talk about their loss in a safe setting and be able to work through that loss in a way that frees them to live the rest of their lives productively. Okay, so questions. Let's have some conversation.
Сестро Донна, скажіть, будь ласка, чи є у вас досвід, коли ні індивідуальні, ні групові форми роботи не давали позитивного результату? Я поясню пізніше.
I've not had it be a negative result, no.
Я поясню тоді свою ситуацію. Є діти, в яких загинули батьки, на фронті загинули. Але, в нас найчастіше чин похорону проходить у закритих домовинах. І діти не вірять цьому. Не бачив, не вірю, не буду. І в цьому їхнє горювання, воно посилюється. І це тупік для роботи.
So thank you for raising that question, because I really was not, this presentation was not focused on child therapy. I was really talking about adults. But I think when you're dealing with a child in that case, clearly the lack of cognition is going to take a long time, and they haven't seen the closure at all, and so that's going to be something that will take a very different approach, and it certainly would not be something I would deal with in a group. First of all, I want to thank you for your patience with this process, because I don't speak your language and I feel so inadequate, so I'm sorry for that. But and then just to say in ending that, again, it is really the language of the heart, where hearts speak to hearts, and we stand together and stand in solidarity with each other in times of suffering. And I know that if the situation were reversed and it was a bunch of Americans that were in a trauma situation, that our friends in Ukraine would reach out to us. So it's my privilege to be able to stand here with you in solidarity and just offer whatever I can to support you in this time. And please know that I will be praying for each of you in your pastoral work, in your professional work with people, the people of Ukraine. And I do pray for you each day. And I will promise to continue now with more images of more faces that I will bring home with me. So God's blessings on each one of you, and thank you for all the work that you're doing to support your people.